Hi there, students, and welcome to Crazy Nurse RN channel, where learning becomes a tradition. I'm Crisel Merducanes, nurse educator, teaching fundamentals of nursing practice. If you have any question or if you want to clarify some gray areas with regard to our topic today, please comment down below. I'll be glad to read your comments and answer your questions. Also, if you want to suggest any topic or content on our next videos, please write them below. And if you find this YouTube channel useful, please click the subscribe button and hit the notification bell to keep you updated for new video uploads. Please do not forget to check the description box below for additional inputs and some clarification with regard to this lecture video. For today's topic, we have implementing phase of the nursing process. What is implementing? It is the action phase in which the nurse performs the nursing interventions. It consists of doing and documenting the activities that are the specific nursing actions needed to carry out the nursing interventions. We also have implementing skills. So nurses who implement nursing intervention should possess these following skills. First, cognitive skills, interpersonal skills, then technical skills. When we say cognitive skills, it is also known as intellectual skills. It includes problem solving, decision making, critical thinking, clinical reasoning, and creativity. And it is crucial to safe, intelligent nursing care. So this means that nurses should be knowledgeable enough in performing the nursing interventions, and they should know the basis or the scientific reasons why they need to perform such nursing intervention. We also have your interpersonal skills. All of the activities, may it be verbal and non-verbal, people use when interacting directly with one another. It uses therapeutic communication to understand the client and in turn be understood. When we say interpersonal skills, that means that nurses have should have the ability to interact with their patient, to relate with their patient, since they will be working with one another in the implementation of nursing skills. We also have technical skills. It is a purposeful hands-on skills such as manipulating the equipment, giving injections, bandaging, moving, lifting and repositioning clients. It is also called as tasks, procedures, or psychomotor skills. Okay. So when we say technical skills, it means that these are the basic nursing skills that nurses should be able to perform. Okay. We also have here process of implementing. First, we need to reassess the client. As what I have mentioned in our previous discussion regarding the nursing process, in each phase of the nursing process, assessment is involved. The same mechanism or the same concept applies in your implementation phase. So before we implement such procedure, we first need to assess the patient. Next, we determine the nurse's need for assistance and implement the nursing interventions. After that, we supervise the delegated care. Then lastly, we document nursing activities. Okay, so we're done with the implementation phase of the nursing process. Now, we'll proceed to the evaluating phase of the nursing process, which is the last phase of the nursing process as well. What is evaluating? It is the fifth phase of the nursing process. It is a planned, ongoing, purposeful activity in which clients and healthcare professionals determine first the client's progress towards achievement of goals or outcome and the effectiveness of the nursing care plan. So in your evaluating phase, we mainly identify here if we have attained our nursing goals and also to determine if our nursing interventions are effective. We also have 5 components of evaluation phase. First, we collect data. We compare data with desired outcomes, relating nursing activities to outcomes, drawing conclusion about the problem status, and lastly, continuing, modifying, or terminating the nursing care plan. We also have evaluating statement. So it consists of 2 parts, a conclusion and supporting data. When we say conclusion, it is a statement that goal or desired outcome was met or not met. Also, we have supporting data. It is the list of clients' responses that support the conclusion. So when we make evaluation statement, these 2 parts should be present. First, you have to determine if the goals were met, not met, or partially met. Then after that, you support it with your assessment findings after the implementation of your nursing interventions. And that proves why you have said that the goals were met, not met, or partially met. We also have your evaluating the quality of nursing care. So it is a very important or essential part of professional accountability. Okay? So in order to maintain and ensure the quality of nursing care, this should be evaluated from time to time. Okay? First, we have here your quality assurance program. It is an ongoing, systematic process designed to evaluate and promote excellence in healthcare provided to clients. So the purpose of your quality assurance program is to make sure that the quality of care is maintained always by nurses. Okay? We also have here 3 components of care. This is based on your quality assurance evaluation. First, we have your structure evaluation, process evaluation, then the outcome evaluation. When we say structure evaluation, it means that it focuses on the setting in which care is given. So basically, when we say setting, it is more of the evaluation of the place or the environment of a particular healthcare institution or hospital. Structural standards describe desirable environmental and organizational characteristics that influence care, such as equipment and staffing. Also, in your structure evaluation, we evaluate here the condition of the equipment as well as the staffing of that particular healthcare organization or facility. We also have the process evaluation. It focuses on how the care was given, and process standards focus on the manner in which the nurse uses the nursing process. So in your process evaluation, here we focus or we evaluate on how things are being done in the organization. So that's your process evaluation. When we say outcome evaluation, it focuses on demonstrable changes in the client's health status as a result of nursing care. So outcome criteria are written in terms of client's responses or health status. In your outcome evaluation, we evaluate here the product or the outcome of nursing care. So we measure here how effective is the nursing care performed by the staff nurses, okay, as well as their evaluation or responses in terms of their satisfaction with regard to the nursing care they receive from nurses. We also have your quality improvement. It follows client care rather than organizational structure, focuses on process rather than individuals. So it uses systematic approach with the intention of improving the quality of care rather than ensuring the quality of care. So in your quality improvement, its main goal is to improve a particular quality of care. Okay? We also have your sentinel events. It is unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. It signals the need for immediate investigation and response. So when we say sentinel events, these are circumstances or instances where a particular error or mistake which are mistakes which are not intended to happen causes death or serious physical or psychological injuries to the patient. We also have here the root cause analysis. So it is the process of identifying the factors that bring about deviations in practices that lead to the event. It focuses primarily on systems and processes, not individual performances. So in your root cause analysis, it means that we determine the main cause of the problem. So it does not blame or it does not focuses on the person who committed the mistake, but rather it focuses on the main reason why that particular mistake or error happened. So probably the reason is the process or the system itself of a particular organization. We also have your nursing audit. What is audit? It refers to the examination or review of records. So we have retrospective audit. It is the evaluation of a client's record after discharge from an agency. Also, we have your concurrent audit. It is the evaluation of the client's health care while the client is still receiving care from the agency or hospital. We also have peer review. Peers appraise the quality of care or practice performed by other equally qualified nurses. So that means when we conduct or perform peer review, it should be an equally qualified nurses. That means if someone evaluates a staff nurses, he or she should be also a staff nurse. If a supervisor evaluates someone, that someone should be a supervisor also. So this means that we have to perform your peer review by way of by review by other equally qualified nurses. Okay? We also have two types of peer review. First, we have your individual audit and your nursing audit. When we say individual audit, it focuses on the performance of an individual nurse. Also, we have in your nursing audit, it focuses on evaluating nursing care through the review of records. So these are the two types of your peer review. So I believe this is the end of my discussion. Thank you so much. I hope you learned something today.